This is the last case for today. It's a very difficult case. I started this case 100% with my Titan. It's impossible to me nowadays to manage a case like this without my Titan. Absolutely impossible, because we had no vertical dimension. Okay, and we had a very difficult patient. She came. It's a woman. 72 years old woman with depression. It's not easy to manage from like a, can I say, from an emotional point of view. The daughter told me, asked me to have everything in few appointments, because she was not good. This was absolutely an amazing case, an amazing proof to me. I started with byte block registration. This was not a patient of mine. This was a patient of a colleague of mine, and she started in analogical world, and after this byte block registration, of course, Voxis, I started 100% in digital world, in my digital world. But in these cases, so you have to think about full edentulous. Is it right to have only the as a parameter to manage only aesthetics and only the lip, the upper lip and lower lip, and the symmetry and the medial line, the bipupillar line, or we can have more? Absolutely, we can have more, and I want to have more, because I start this registration with the Titan. And this is how I manage this imbalance. I started with absolutely an imbalance, and I rebalance the Voxis. After that, everything in a digital world, and this is the lab side, and we have the digital workshop of the missing teeth, of course, and we printed this digital workshop, and this is the try-in. And like I said before, this is the most important time for this kind of rehabs, because we can have a lot of tries. We can change everything. We can change the tooth dimensions and shapes and the length, like in this case, and symmetry, and of course the contact points, but only if we have and we can manage the Titan, because these are the values with my it's bigger. These are the values with my try-in at starting, the pre and the post. Just a few checks, a few bars, and everything looks amazing. From the muscles side, the muscles point of view. This is the Titan. The muscles point of view. We undergo the CBCT on the upper and lower jaw, the project, everything again to the lab. We have to manage a lot of information, but in this digital area, everything is possible for our technician. Virtual extractions. The workshop is like a guide for the final restoration. These are the virtual abutments. The virtual workshop of the final restoration. These are the structures. I prefer, of course, screw retained Toronto bridge, screw retained implant bridges. Okay, these are modeled at the same time, and the contact points were checked before on the train with the Titan. This is amazing. Okay, of course we have to we want to prove that everything is right. Okay, this is a gypsum trying, but the gypsum it's not related to analogical impression. Okay, these are the real models printed, and everything is ready for the surgery. It's very fast, my surgery. This is the smile of the patient after half an hour or maybe 45 minutes. Very, very, very fast, very easy. Okay, there's nothing difficult during this kind of surgeries. Full guided, everything was good, everything is okay, everything is ready before the surgery. Okay, the patient was very, very, very happy. But what about Titan? This on the right side is the Titan the day of the surgery. It's not perfect because the impact, it's not 100%, but you can imagine that it's absolutely a great change between no vertical dimension and a vertical dimension like this. It's absolutely mind-blowing. Okay, and this is after only 30 days, 1 month. Everything is perfect. The patient was good, everything was good, no pain at all. Okay, and this is my approach to these were only a few examples of my approach in prosthodontics. I hope you enjoyed